So, take a look at the picture behind you. This is one of the communities we're working with. And there's actually two communities there. There's the people who live there and the people that work there. Just hang on to that image of the two communities. And I'm just briefly going to talk you through my question. And it's about health inequalities. And it's about why are we so bad in this country at preventing, because it's all preventable, the poor health of the poor. Why has billions of government investment, given the link with poverty, billions of pounds worth of investment in communities that are struggling, poor communities, it hasn't made a jot of difference. So I'm going to tell you a little bit today about something that does make a difference. And it's got nothing to do with money. It's got everything to do with enabling, connecting, and listening. And the story for me began in the 60s. And I was born in a council house. I was seriously awful at school in the 60s, in my teenage years, because I was obsessed with the Beatles. Utterly obsessed. Good obsession to have. But 1967, two deeply traumatic events happened to me, very painful. The pain is still with me now. Paul McCartney married somebody else. And I had my tonsils out. And I went to hospital and felt completely right there. 2 years later, so I was a nurse at King's College Hospital, I was confronted with health inequalities, and I saw the stark contrast. I went out with the community midwife. You know the midwife on Sunday night? That's me, on the bike, cycling around, taking delivery packs around Lewisham. And you see a lot on a bike. It just hit me, the stark contrast between the people at the bottom of the hill in Lewisham, how well they were, and how unwell. Sorry, wrong way round. How unwell they were at the bottom of the hill, and how well they were at the top of the hill in Blackheath. And that kind of had a big effect on me. So I became a health visitor in the 70s, moved to Cornwall, did not expect to have the challenges that I had in Cornwall. So I learned about, Cornwall's actually the poorest county, I'm sure you all know that. And I learned in the 70s as a health visitor, had some of my worst child protection challenges ever. And realised then the power of being disconnected. If this was about rural poverty and how isolated, and isolation. Then in the 80s, I worked with teenagers on remand, in care, and I learnt the devastating consequences. All those kids were born into poor circumstances of not being listened to. Those young people, I'd love to say I was still in touch with them. I'm not, because they took their own lives. Okay, fast forward to the 90s. Health visitor. Have a look at that picture. It's cheek by jowl, affluence and poverty. You don't expect to see that in Falmouth. That estate at the back of the multi-million-pound marina was the poorest ward, it was a council ward, we called it the Beacon Estate, but it was actually Penwerris, council estate of Penwerris, poorest ward in the poorest county. And in the early 90s, I was a health visitor there for a decade, 1990 to 2000. I watched it spiral out of control. And then in 1994, I became part of a process that saw it a complete rebirth, if you like. They turned things around for themselves. And this is how we did it. When you're faced, if I just give you one sentence, I won't give you stats of how bad things were on that estate. If I tell you that as a nurse, I had to have police protection at one point, this was a community pushing the self-destruct button, totally. We were health visitors, we couldn't cope. There was a recession on, cutbacks, 1994, meltdown. We knew we had to work in a different way. We could not cope. It was a bottomless pit of need. We could not cope with their illness, with the depression levels, so we knew we had to do something different. Our starting point maybe, and when I'm saying it was two of us, two health visitors, was that we actually really, really believed that the community, the residents, we believed in them. They were the solution and not the problem. That's what we believed. Everybody else, the police, local authority, every other statutory agency had abandoned that community. They were just not there. They were invisible. Think of the two communities. So we knew we had to somehow protect them, connect them, how are we going to do this? We were run off our feet. Well, this is where enablement kicks in. And I had a wonderful nurse manager, very glamorous lady, Anita Filer Cooper. And when Phil and I said to her, we've got this idea of turning around the community, but we think the residents need to lead it, she didn't say you're bonkers. She didn't say sicked away and baby. She said, what can I do to help you? Big message there. Okay. So, connecting, bringing back that second community, bringing back the police, bringing back all the other services we needed. We couldn't fix Beacon on our own. Lots of cynicism. We asked them, we said, please come and help us. We think the residents need to lead this if we want real change. Will you come and join us? There were possibly 30 agencies who could have joined us. 3 did, and that was the police, that was the local authority, and that was education. We then went to the residents. We asked 20 to help us. Wonderful, brave, courageous people. Mums and dads who just wanted a better life for their kids. Out of 25 self-selected. You had to be brave because it was a scary place. Okay, we call them the famous 5. Because they were. Do you know what they did? To help get that collective voice. Remember, this was a desperate, desperate estate. It was survival. Nobody was connected to anybody. We connected them. The service providers listened. In 4 years, this is what all the housing looked like. In 4 years, quite quickly, we had got £2.2 million. The residents got it, not a handout. That's important. We were nominated for an award. We met regularly over those 4 years. So that's the service providers and the famous 5. Magic started to happen. And while we were meeting, the community started to come together. Marvellous things started to happen. They were fundraising for themselves. They were taking responsibility. All sorts of organisations started to spring up. Their imagination was boundless. To raise money, they did bungee jumping. They did pig racing. Don't ask. It was nothing to do with the police. Okay. And we got 4 years down the line, and we knew something wonderful was happening, and we might have left it there, because suddenly all our jobs, we could do our jobs. I could do my health visiting. The crisis, it had all gone, people said. Then we had somebody nominated for this award, and a number cruncher said, what are your outcomes? And we hadn't counted anything. We were too busy doing it. And our outcomes were quite amazing. Remember, didn't even say this to you, when the residents spoke to the service providers, they said they wanted 3 things fixed. They wanted jobs, they wanted their homes done, fixed up, and they wanted the crime to go. So in those 4 years when we counted, there was a 50% drop in all crime, right across the board, 71% drop in unemployment, and this is what the houses look like. But you know what else happened at the same time? We started counting other things. Boys' educational attainment had gone up 100% because we had brought postnatal depression down by 70%. Asthma rates dropped 50%. So they'd got themselves well, hadn't they? So I'm going to fast forward you. No, the gardens. Sorry. How well do people feel? Look, that's what the gardens used to look like. This is what made people well. They felt good about themselves. Okay, and I think one of the famous 5, this is what he said. And this is the beating heart of Beacon. It never went back to the way it was. All right, the residents still lead. Beacon Community Regeneration Partnership, B-crap. Okay. And this was wonderful. Something very powerful had happened, and I wanted to replicate this. How was I going to do this? Then I met my enabler, and he's here today, Jonathan Stead. Jonathan said, I think this had something to do with complexity theory. I was so cynical. Complexity theory, I can see you. God, How dull is that? It just sounds so dull. Actually, it should be called the theory of everything that's wonderful about fixing broken communities, because, guys, it's all there. The self-organising, the creating enabling conditions. I'm not going to go into it now because I'm running out of time, and I really want to get on to something else. But believe me, that gave me the permission. We've spread this stuff everywhere now. We connect communities. We do exchange visits. This is New Crossgate and Falmouth. This was jerk chicken meeting Cornish pasty. That's how we connect. The power of listening. The power of listening. The first guys ever to do connecting communities. We put it together, 2 years of research. We put it together in a course by now. And complexity was at the heart. Listening, it is so important. If you listen to a damaged community, it will always tell you what it needs to heal. And it's nothing to do with needs assessment. It's nothing to do with consultation. You just listen. Exchange visit. Okay. TR14 is Dave listened. The kids said they wanted to dance. The power of dance to heal Camborne was extraordinary. Look at those cool dudes. In 4 or 5 years, education attainment had gone up, antisocial behaviour had dropped, their health had improved. It impacted on every part of Camborne, that community where child poverty rates were through the roof. I'm going to finish with this. Never, ever give up. That's something we call a Trojan mouse. Do something small and wonderful things will happen. It's tough, it's hard doing this, the rewards are huge. Seriously, I'm going to finish this. I just want to show you all over the country where connecting communities is now, and where communities are healing and transforming because they're enabled, because they're connected, and because they're listened to. And that just says it all. Do you know Laotzi, 600 BC? I think that guy had somebody with an iPad. There's lots of his quotes going around, aren't there? But that says it all. We have done it for ourselves, and that's what they're saying all over the country. And thank you very much, everybody.